Blood. Blood is a driving life force. It is a bodily fluid that circulates through the human body, coursing through arteries, veins and capillaries. Blood circulates in a closed vascular system in our bodies. This is different from the open vascular system of organisms like insects or crustaceans, where blood flows from the heart to body tissues without vessels. Blood is generally a thick fluid. It is dark red when taken from the vein and bright red when taken from the artery. An average adult contains 5 to 6 liters of blood, which accounts for 8 to 10% of body mass. Blood is also slightly alkaline with a pH of 7.3 to 7.45. One of the most important functions of blood is transportation of substances to tissues and organs. Blood carries substances like glucose, vitamins, amino acids and hormones, among others. Blood consists of a fluid part called plasma and a cellular part referred to as formed elements. Plasma is a light yellow alkaline fluid that contains 90% water, about 7% proteins and 1% inorganic salts such as sodium chloride and sodium bicarbonate. While plasma constitutes 55 to 60% of blood, formed elements constitute 40 to 45%. These formed elements are red blood cells or erythrocytes, white blood cells or leukocytes, and blood platelets or thrombocytes. Red blood cells or erythrocytes are minute biconcave disc-like structures that are flat in the middle and rounded at the edges. That is biconcave in shape. They are only 7 microns in diameter and contain no nucleus. The size of red blood cells allows them to travel through the fine capillaries and reach any part of the body. There are in fact about 5 million red blood cells per cubic millimeter of blood in adult males and 4.5 million per cubic millimeter of blood in adult females. Red blood cells are essentially oxygen carriers. They contain molecules of hemoglobin that are part iron or hemin and part protein or globin. Hemoglobin has the unique ability of combining with oxygen in the blood and forming oxyhemoglobin. The surface area of red blood cells, coupled with features such as loss of nucleus and mitochondria, allows for maximum absorption of oxygen. This makes red blood cells very efficient oxygen carriers. While hemoglobin is responsible for carrying oxygen to needy tissues, it also carries a small amount of carbon dioxide in the form of carbaminohemoglobin. Hemoglobin sometimes combines with carbon monoxide to form a stable compound called carboxyhemoglobin. This reduces the capacity of blood to transport oxygen and can even result in death. This is known as carbon monoxide poisoning and can occur by inhaling smoke in poorly ventilated environments. While erythrocytes are produced in the liver and spleen of embryos, they are produced in the marrow of long bones in adults, especially in the ribs, breastbone, and ileum. Erythrocytes initially possess a nucleus, but lose it and become enucleated as they mature. They live for about 120 days before they are destroyed in the liver, spleen, and bone marrow. In a normal adult, about 20 into 10 raised to 6 red blood cells are destroyed every day. Sometimes, though, there might be an abnormal increase in red blood cells. This is known as polycythemia. An abnormal decrease in numbers is called erythropenia. Blood cells or leukocytes are the body's defense system. Only 4,000 to 8,000 leukocytes are found per cubic millimeter of blood. Their lifespan is around 2 weeks, and they are destroyed in a similar manner as red blood cells. Most leukocytes are amoeboid and produce pseudopodia in order to travel around the body. They can squeeze through the walls of capillaries and into tissues by a process known as diapedesis. Leukocytes can be classified into two major groups, granular and non-granular. Granular leukocytes contain granules, and the nucleus is constricted into lobes. Non-granular leukocytes are without granules and contain a single large nucleus. Granular leukocytes consist of neutrophils, eosinophils, and basophils. They are produced in bone marrow. The nucleus of a neutrophil has 3 to 4 lobes, and the cell is stained with neutral dyes. The primary function of a neutrophil is to kill bacteria that invade the body. The nucleus of an eosinophil has only 2 lobes, and the cell is stained with dark red dye. Eosinophils secrete antitoxins and are associated with allergy. In a basophil, the nucleus is large and indistinctly lobed, and the cell is stained with basic dyes. Basophils release chemicals known as histamines for inflammation which dilate blood vessels. Lymphocytes are the smallest of the white blood cells. They are non-granular, possess a single large nucleus, and are produced in bone marrow and lymph glands. The primary function of a lymphocyte is production of antibodies. Monocytes are kidney-shaped, non-granular white blood cells. They ingest germs and are produced in bone marrow. But how exactly do white blood cells protect the human body during times of infection? White blood cells move towards the site of infection and engulf bacteria using pseudopodia through a process known as phagocytosis. White blood cells count can increase up to 50,000 per cubic millimeter during an infection. Sometimes inflammation of body tissue occurs as a reaction to injury or localized invasion of germs. Leukocytes, especially neutrophils and monocytes, fight germs and destroy any damaged cells during the process of phagocytosis. Pus is in fact composed of dead leukocytes and tissue cells destroyed by bacteria. The antibodies produced by white blood cells act as antitoxins and neutralize toxins released by bacteria. This principle is utilized for the process of vaccination when weakened germs or germ substances are injected into the body. A cancerous disease known as leukemia causes an increase in the number of white blood cells, usually at the cost of red blood cells. An abnormal decrease in the number of white blood cells, on the other hand, is known as leukopenia. Blood platelets or thrombocytes are responsible for blood clotting. They are minute oval or round nucleated structures. There are about 200,000 to 400,000 platelets per cubic millimeter of blood in adults. Platelets are produced from giant cells called megakaryocytes in the red bone marrow. They have a lifespan of 3 to 5 days and are usually destroyed in the spleen. When a blood vessel is cut, blood begins to flow out of it. However, blood platelets soon form a clot and stop the flow of blood. This process of clotting is called coagulation. Platelets release an enzyme known as thromboplastin or thrombokinase or factor X. This reacts with calcium ions in the plasma and converts prothrombin to thrombin. Thrombin is responsible for converting soluble fibrinogen into insoluble microscopic threads of fibrin. Fibrin threads are sticky and form a mesh at the wound. They trap blood cells and ultimately squeeze out the rest of the plasma or serum in the form of a clear liquid known as serum. The solid mass left behind is what is called a blood clot or thrombus. If fresh blood is taken in a test tube, a blood clot will form, with the serum collecting on the surface. However, if fresh blood is stirred with a twig, the fibrin threads will instead collect on the twig. The liquid left behind, consisting of serum and corpuscles, will not clot and is known as defibrinated blood. Sometimes blood can clot even without coming in contact with the air, as in the case of blood blisters. These blisters may be formed due to injuries like a sharp pinch when the skin does not break. Vitamin K is essential to the process of blood clotting. It is required for the production of prothrombin in the liver. Deficiency of vitamin K can slow down the clotting process of 2 to 5 minutes. If the number of platelets falls drastically, coagulation can slow down and even result in internal bleeding or hemorrhage. Blood clots can also occur due to the movement of blood over a rough surface. This can occur as in the case of blood moving over a cholesterol deposit on the inside of a blood vessel. Often during surgical operations, a blood transfusion is required. Blood from a healthy person is injected into the patient's veins. However, the two blood types must be compatible, as the patient may otherwise develop adverse reactions. According to the ABO blood system, there are 4 types of blood: A, B, AB, and O. While blood type O can be given to people of all blood types, a person with blood type AB can receive all blood types. So O type is called the universal donor and AB type is called the universal recipient. A person with type A can receive blood only from types A and O. Similarly, a person with type B can receive blood only from types B and O. However, a person with type O can receive blood only from type O. There is another important substance contained in human blood, referred to as the rhesus factor or the Rh factor. This factor was first discovered in a common monkey, Rhesus. If Rh positive blood is transfused to a person who does not possess the factor in his blood, he will develop an antibody for the Rh substance. If blood is transfused a second time, the Rh negative person may develop an allergy, even resulting in death. The Rh factor can create complications during pregnancy. If an Rh negative mother carries an Rh positive baby, the fetus may die. This usually occurs if the mother previously had an Rh positive child and developed antibodies for the Rh factor. The circulated blood has a key role in the functioning of the human body and determines the state of our health to a great extent.